Hello friends, this is Dr. Arshin Horchandani and welcome back to our channel. Today we're going to talk about a few more things about implant crowns, in specific screw retained and cement retained implant crowns. These are the two types of crowns that are commonly used to replace the teeth that are missing on the implants that have been previously placed. Let's talk about screw retained crowns first. The major advantage of screw retained crown is their retrievability. What this means is basically a screw retained crown is screwed down into the implant, which enables it to be unscrewed out also as easily when required. This retrievability of the implant crown enables us to fix any future complications that might occur with the implant. It also enables us to relayer the implant crown as and when required. And of course, it gives us the flexibility of changing the type of restoration very easily in the future. This means that a single implant crown can be connected to another implant crown in the future and converted to a bridge or even a full arch fixed prosthesis. The second major advantage of a screw retained implant crown is the fact that no cement is used to cement the crown onto the implant. This means that the amount of cement that is in excess does not need to be cleaned up, so that leads to lesser complications related to cement. And of course, it's known in literature that excess cement can cause peri-implantitis. So the chances of peri-implantitis happening around a screw retained crown are literally less. Now let's talk about some of the disadvantages or problems that can happen with screw retained crowns. The first thing that needs to be taken care of while doing screw retained crown is the implant positioning. The implant positioning has to be very accurate and has to be placed in a manner such that the screw access hole can easily be concealed. If the screw access hole is emerging from the front of the tooth, then it might be a little tricky to mask that hole, especially when doing front or anterior tooth cases. In such cases, sometimes doing a cement retained crown turns out to be a more aesthetic option. Another potential problem that can happen with screw retained crowns is screw loosening over time. This can happen due to non-axial loading of the forces of chewing onto the crown. This means that if the crown is not very accurately designed and the screw loosens over time, it might need some retightening and the crown might have to be refitted. This complication, however, is easily solvable and does not require a lot of chair time, neither does it require sending the crown to the lab. It can be easily fixed by any dentist as long as they know what system of implant has been used. The third point of consideration is the cost. Potentially, screw retained components may require a little bit more inventory or a different kind of a component that might add to the cost of the implant in general. However, even though the costs involved with screw retained crowns can be on the higher side slightly, the benefits definitely outweigh the costs. So it is always preferable to do screw retained crowns when possible. Coming to the next type of crowns, which is cement retained crowns. Now with cement retained crowns, there are their own set of advantages and disadvantages. So let's first talk about the advantages. The first advantage that a cement retained crown offers is generally much better aesthetics, especially in the anterior, like we discussed before. If it is not possible to have a crown which has a screw access hole emerging from the labial side or the front side of the tooth, then a cement retained crown is a preferred choice of crown in such situations, as it is a little tricky or hard to mask the screw access hole, especially in a front crown. The second advantage that cement retained crowns offer is the simplicity of placement. As most dentists are easily accustomed to placing crowns that are cemented on teeth, placing a cement retained crown on an implant comes naturally to them. Therefore, they don't have to struggle with the screw tightening or the screw loosening process. The third advantage that cement retained crowns offer is of the cost. Because cement retained crowns are generally made over stock components, the cost of these components is generally lower. Also, the lab charges involved in fabricating a cement retained crown are generally lower compared to those of a screw retained crown. However, there are other disadvantages of cement retained crowns. The first disadvantage is that you cannot retrieve these crowns very easily. It is often very cumbersome or tricky and may require actual sectioning or cutting out of the crown to retrieve these kind of crowns. The second disadvantage of these kind of crowns is that if there is any cement excess that is left around the margins of these crowns, and if this cement goes subgingivally, there is always a potential risk of peri-implantitis or infection around the implant happening. This cannot be cleaned up as effectively no matter how hard it is tried to. Therefore, the cement always poses a risk or a threat to peri-implantitis or implant-related infection in the future. The third disadvantage with cement-retained crowns is that when these crowns are cemented, the junction of the crown and the implant is generally below the gum. This area, if left open or exposed, can lead to food accumulation in this area. This open margin can lead to other problems in the future, such as gum inflammation and also bleeding from gums. Therefore, while considering the choice of crowns for your implant, please discuss thoroughly with your dentist what is recommended and what is the best possible scenario for your case. Not every implant crown is a possibility for every patient and might not be recommended for your particular case. It is very essential for you to sit down with your dentist and the dental laboratory to take an informed decision about what kind of crown will be made for you. If you felt our content was informative and liked our channel, then please don't forget to subscribe and like our videos. Thank you.